Here's a fully detailed nursing pharmacology-style drug monograph for levocetirizine, covering each section in depth so you can use it for both exams and practical reference. Number 1, basic drug information. Generic name, levocetirizine dihydrochloride. Drug class, second-generation antihistamine, selective H1 receptor antagonist, piperazine derivative. Drug forms, tablets, 5 milligrams film-coated, oral solution syrup, 0.5 milligrams per milliliter, 2.5 milliliters, oral drops, 2.5 milligram milliliters in some pediatric formulations. Brand names, international, Xyzal, Levrix, Xusal, India, Texine, Levocet, Levosiz. Other markets, Elset, Allerset, Cetirev. 2. Definition: Levozine is the active R enantiomer of cetirizine, designed to provide potent antihistamine effects at lower doses with reduced sedation compared to first-generation antihistamines. It treats allergic symptoms by blocking histamine's action in the periphery without significantly crossing the blood-brain barrier. Number 3. Mechanism of action. Histamine role. Histamine, released during allergic reactions, binds to H1 receptors in the respiratory tract, eyes, skin, and vascular endothelium, causes vasodilation, increased permeability, edema, and sensory nerve stimulation itching. Levocetirizine, action, competitively and selectively inhibits peripheral H1 receptors. Prevents histamine-induced vasodilation, vascular leakage, and sensory nerve activation. Reduces nasal ocular symptoms and urticarial rash. Minimal CNS penetration, low sedation. Pharmacokinetics, absorption rapid, peak plasma levels in 0.9 ERS, protein binding 90%. Metabolism, minimal hepatic metabolism, mainly excreted unchanged in urine. Half-life, 28 to 10 hours. Excretion, primarily renal. Number 4, uses, therapeutic effects. Symptomatic relief of seasonal allergic rhinitis, hay fever. Perennial allergic rhinitis, year-round allergies to dust, mold, pets. Chronic idiopathic urticaria, hives of unknown cause. Itchy skin conditions related to histamine release. Number 5, indications. Sneezing, rhinorrhea, runny nose, nasal congestion, itchy, watery eyes due to allergies. Pruritus, skin itching. Chronic hives with or without swelling. 6, contraindications. Hypersensitivity to levocetirizine, cetirizine, hydroxyzine, or any excipients. End-stage renal disease, CRCL 10 milliliters per min. Pediatric patients under the age limits for specific formulations. Tablets, usually not for 6 years. Oral solution not for 6 months, may vary by country. Number 7, before taking precautions. Renal impairment, dose adjustment required. Monitor renal function. Liver disease, usually no adjustment needed, but caution if severe. Epilepsy, seizure disorders, may slightly increase seizure risk. Elderly, monitor due to reduced renal clearance. Pregnancy, category B, safe in animals, limited human data. Breastfeeding, passes into breast milk, use with caution. Alcohol and sedatives, even though it's non-sedating, concurrent use can increase CNS depression. Driving operating machinery, avoid until individual response known. 8, how to use. Tablets, swallow whole with water, can be taken with or without food. Oral solution, measure with calibrated device, shake well before use. Best taken in the evening to control nighttime morning symptoms and reduce potential drowsiness during the day. Number 9, dosing information. Adults and adolescents 12 years, 5 milligrams orally once daily. Children 6 to 11 years, 2.5 milligrams orally once daily, half tablet or 5 milliliter solution. Children 6 months 5 years, solution, 1.25 milligrams orally once daily, 2.5 milliliter solution. Renal impairment adjustment, CRCL 50, 80 milliliters per min, 5 milligrams once daily. KRCL 30 for 49 milliliters per min, 5 milligrams every other day. CRCL 10 to 29 millimin, 5 milligrams twice weekly. CRCL 10 millimeter contraindicated. Number 10, missed dose and overdose. Missed dose, take as soon as remembered unless near next scheduled dose. Never double up. Overdose, adults, drowsiness, somnolence. Children, initial agitation, restlessness, profound drowsiness. Management, symptomatic and supportive. No specific antidote. Consider gastric lavage, activated charcoal, and early ingestion. Number 11, stop or avoid taking. If you develop allergic reaction, rash, swelling of face, lips, tongue, breathing difficulty, severe skin reactions, rare, new or worsening seizures, acute urinary retention symptoms. Number 12, side effects detailed. Common 1%, somnolence, drowsiness, fatigue, dry mouth, nasopharyngitis, headache. Uncommon 0.1%, abdominal pain, nausea, diarrhea, increased appetite. Rare point-point tachycardia, vision changes, blurred vision, aggression, confusion, hallucinations, convulsions, allergic reactions, urticaria, angioedema, anaphylaxis. 13. Vital information, key nursing points. Monitor allergy symptom relief and any CNS side effects. Assess renal function before starting, especially in elderly. Educate patient about measuring liquid doses correctly. Warn about potential mild sedation despite being a non-sedating antihistamine. Advise avoiding alcohol and sedatives. Number 14. Drug interactions. Alcohol and CNS depressants, benzodiazepines, opioids, sedatives, increased drowsiness. Other antihistamines, additive side effects without extra benefit. Ritonavir and theophylline may alter levocetirizine metabolism, minor clinical effect. Anticholinergic drugs, increased risk of dry mouth, urinary retention. Thank you. Have a nice day.